1884, a young doctor placed a single drop of liquid on a patient's eye and changed surgery forever. But within 20 years, that same substance would destroy thousands of lives, topple careers, and force medicine to confront a question it had never asked. What if our miracle cure is killing us?
For 3,000 years, the Inca walked the spine of the Andes, chewing leaves that made hunger vanish and exhaustion disappear. The coca plant grew in the thin air of the mountains, its leaves woven so deeply into the fabric of Andean life that the people called it a gift from the sun god himself. Messengers ran hundreds of miles across impossible terrain, their cheeks bulging with coca. Laborers worked at altitudes that would leave lowlanders gasping, sustained by the green leaves they carried in woven pouches. When Spanish conquistadors arrived in the 16th century, they initially condemned the practice as devil worship, but they noticed something remarkable. The silver miners who chewed coca could work longer, eat less, and survive conditions that killed others within months. The Spanish reversed course. They began paying workers in coca leaves. The plant became currency, medicine, and survival itself. For centuries, coca remained confined to South America. Europeans heard stories, strange tales of magical leaves, but the plant itself refused to cooperate. Coca leaves lost their potency during the months-long voyage across the Atlantic, arriving in European ports as worthless, crumbling vegetation. The secret of the mountains stayed in the mountains. Until 1859. That year, a German chemistry student named Albert Niemann was working in a laboratory in Göttingen, grinding dried coca leaves into powder, mixing them with chemicals, watching reactions bloom and fade in glass beakers. He was hunting for the active principle, the single chemical compound responsible for coca's effects. For weeks, nothing. Then, one afternoon, white crystals began forming in his solution. Niemann isolated them, purified them, and touched a few flakes to his tongue. His mouth went completely numb. He had extracted cocaine in its pure form, and he had created something unprecedented. This wasn't a leaf to be chewed. This was a concentrated alkaloid, potentially hundreds of times more powerful. Niemann published his findings, noted the strange numbing effect, and died 2 years later, probably never imagining what he had unleashed. For 2 decades, cocaine remained a laboratory curiosity. A few chemists experimented with it. A few doctors noted its properties in obscure journals. But no one saw the revolution coming.
The breakthrough came not in a laboratory, but in a consulting room in Vienna, where a struggling young neurologist was trying to make his name. Sigmund Freud was 28 years old, ambitious and poor. He wanted to marry, but couldn't afford it on a junior doctor's salary. He needed a discovery, something that would make him famous, secure his position, give him the life he imagined. In April 1884, Freud read about cocaine's effects and saw opportunity gleaming in those white crystals. Freud ordered a sample and began experimenting on himself. He dissolved cocaine in water and drank it. The effect was extraordinary. His depression lifted, his energy surged, his mind felt sharp, crystalline, capable of anything. He stayed up through the night writing, ideas flowing faster than he could capture them. He gave cocaine to his colleagues, his friends, his patients. Everyone reported the same miraculous effects. Depression vanished, fatigue disappeared, confidence bloomed. Freud became convinced he had found a wonder drug, a cure for morphine addiction, for depression, for the malaise of modern life itself. In July 1884, Freud published Über Coca, a passionate endorsement of cocaine's medical potential. He called it a magical substance. He recommended it for depression, digestive disorders, asthma, as a cure for morphine and alcohol addiction, as a stimulant for mental and physical work. The paper was part scientific report, part love letter. But Freud made a curious omission. He barely mentioned the numbing effect that Niemann had discovered 25 years earlier. He was interested in cocaine as a stimulant, as a psychiatric cure. He overlooked the property that would actually change medicine. That discovery fell to his friend. Karl Kaller was an ophthalmologist working in the same Vienna hospital. Eye surgery in 1884 was a nightmare. Patients had to be held down, conscious and screaming, while surgeons worked as quickly as possible on tissues that moved with every breath, every involuntary flinch. General anesthesia existed, chloroform, ether, but it made patients vomit, and vomiting during eye surgery could destroy the eye completely. Kaller heard Freud talking about cocaine's numbing effects on the tongue, and he wondered, what if that numbness could work on the eye? On September 15, 1884, Kaller prepared a 2% cocaine solution. He placed a single drop in a frog's eye. Then he touched the cornea with a pin. The frog didn't react. He tried a rabbit. Same result. Then he turned to his assistant and said, "My eye." The assistant applied the cocaine solution. Kaller waited a moment, then touched his own cornea with a pin. He felt nothing. Surgery would never be the same. Within weeks, Kaller presented his findings at a medical conference. The news spread across Europe like a shockwave. For the first time in human history, doctors could operate on the conscious eye without pain. Cataracts could be removed without restraints, without screaming, without trauma. Patients walked into operating rooms and walked out seeing again. Other doctors immediately began experimenting. William Halsted at Roosevelt Hospital in New York injected cocaine near nerve trunks and discovered he could numb entire regions of the body, inventing what we now call nerve block anesthesia. Surgeons could amputate limbs while patients read books, fully conscious but feeling nothing. In dental offices, cocaine transformed the practice overnight. Teeth could be extracted without agony, without the patient gripping the chair in terror. One dentist reported performing 43 painless extractions in a single day. The medical journals overflowed with enthusiasm. Cocaine was hailed as one of the great discoveries of the age, comparable to the stethoscope, to antiseptic surgery, to the microscope itself. It had unlocked an entirely new dimension of medicine, surgery without suffering. And it was so simple. Just a few drops, a few injections. What could possibly go wrong?
By 1885, cocaine had escaped the hospital. Pharmaceutical companies, sensing opportunity, began adding it to everything. Park Davis, one of America's largest drug manufacturers, marketed cocaine in 15 different forms: cigarettes, crystals, liquids, ointments, sprays. Their advertisements promised relief from hay fever, toothaches, exhaustion, nervousness. A Corsican chemist named Angelo Mariani created a wine infused with coca extract. Vin Mariani became the most celebrated tonic of the era. Pope Leo XIII awarded it a gold medal and appeared in its advertisements. Thomas Edison endorsed it. Jules Verne drank it while writing. Queen Victoria kept it in the palace. The drink promised vigor, mental clarity, and relief from the exhaustions of modern life, and it delivered because every glass contained a substantial dose of cocaine. In Atlanta, a pharmacist named John Pemberton, trying to create his own coca wine, developed a syrup he claimed could cure morphine addiction, headaches, and neuralgia. He called it Coca-Cola.
The original formula contained cocaine extracted from coca leaves, not enormous amounts, but enough to provide a noticeable lift. It was sold at soda fountains as a brain tonic and intellectual beverage. Cocaine appeared in catarrh remedies, asthma cures, teething powders for infants. You could buy it over the counter at any pharmacy, no prescription required. Hay fever sufferers sniffed cocaine powder and felt instant relief. Opera singers used cocaine sprays to numb their throats before performances. The substance permeated medicine so thoroughly that doctors stopped questioning it. It was simply there, like aspirin, like quinine, a tool in the kit, something reliable and useful. Freud, meanwhile, had given cocaine to a colleague named Ernst von Fleischl-Marxau, who was suffering from terrible pain after a thumb amputation and had become dependent on morphine. Freud believed cocaine would cure the addiction. Instead, Fleischl-Marxau began taking massive doses of cocaine, sometimes injecting a full gram in a single day, more than 20 times the therapeutic dose. Freud watched, growing uneasy, but said nothing publicly. He was still publishing papers praising cocaine. His reputation was tied to it now. But across Vienna, across Europe, across America, doctors were beginning to see something disturbing.
The cases arrived quietly at first, scattered, easy to dismiss. A dentist in Michigan reported a patient who had collapsed and died after a routine cocaine injection for a tooth extraction. The dose had been normal. The patient had been healthy. The death was inexplicable. A surgeon in New York described a woman who developed convulsions during a minor procedure after receiving cocaine for local anesthesia. She survived, but barely. An ophthalmologist wrote that a colleague had applied cocaine to a patient's eye and the patient had gone into cardiac arrest on the operating table. These were isolated incidents published in medical journals, but not yet connected into a pattern. Doctors assumed the deaths were anomalies, bad batches of cocaine, unusual patient sensitivities, dosing errors. But the cases kept coming. Then came the addiction. Patients who had used cocaine medically began seeking it out recreationally. Workers discovered that sniffing cocaine powder made 12-hour factory shifts bearable. Performers used it to sustain energy through long nights. Society women took it for weight loss and vitality. And once they started, many couldn't stop. Fleischl-Marxau, the Freud's friend, was deteriorating visibly. He experienced hallucinations, visions of white snakes crawling on his skin, insects burrowing into his flesh. He became paranoid, erratic, violent. The cocaine that was supposed to cure his morphine addiction had created something worse. A man dependent on both drugs simultaneously, his body disintegrating, his mind fragmenting. In 1887, Fleischl-Marxau died. The official cause was the original infection from his thumb injury, but everyone who had watched his decline knew cocaine had destroyed him. Freud withdrew from cocaine research abruptly and completely. He never published another word about it. In later writings, he barely mentioned it, as though those years had been an embarrassing lapse. When critics pointed out that he had praised a dangerous drug, had perhaps contributed to deaths and addictions, Freud deflected, minimized, changed the subject. Carl Kohler, who had discovered cocaine's use in eye surgery, also saw his career damaged. He had been using cocaine himself, heavily, and was accused of performing surgery while intoxicated. He emigrated to America under a cloud of suspicion. The medical community was waking up to a grim reality. Cocaine was unpredictable. A dose that worked perfectly in one patient could kill another. There was no way to know who was safe. And beyond the medical deaths, there was the addiction. People who began using cocaine for legitimate medical reasons and found themselves trapped, their lives consumed by the need for more. Doctors began documenting what they called cocaine habit. Patients reported needing ever-increasing doses to achieve the same effects. When they tried to stop, they experienced crushing depression, exhaustion, paranoia. Some became violent, some hallucinated,
Some simply vanished into the underground of addiction. A New York physician named J.B. Madison published a survey in 1887. He had identified over 400 cases of cocaine addiction in medical settings alone. The real number, he suspected, was vastly higher. The miracle was curdling into catastrophe.
By 1900, cocaine's reputation had collapsed. Newspapers that once praised it as a wonder drug now ran horror stories. The cocaine fiend who murdered his family in a paranoid rage. Society women enslaved by the drug, spending fortunes to maintain their habits. Death in the dentist's chair after a routine injection. The American Medical Association began investigating. What they found was damning. Thousands of cases of addiction, hundreds of deaths, and a pharmaceutical industry that had marketed cocaine with almost no understanding of its dangers. The pattern of cocaine death became clear. The drug caused blood vessels to constrict violently. In some patients, this triggered heart attacks or strokes, even at therapeutic doses. There was no test to predict who was vulnerable. Every injection was a gamble. And the addiction was proving nearly impossible to treat. Morphine addiction was terrible, but doctors had learned to manage it with gradual reduction. Cocaine addiction was different, more psychological, more insidious. Patients who stopped using cocaine might be physically recovered within weeks, but the mental craving persisted for years. Many relapsed, many died. The racial dimension made regulation politically easier but morally ugly. Newspapers ran sensational stories about cocaine use in black communities, often fabricating or exaggerating connections to violence. Southern politicians claimed cocaine made black men superhuman and dangerous, lies designed to stoke fear and justify oppressive laws. The racism was blatant and deliberate, but it accelerated the political will to ban the drug. In 1906, the Pure Food and Drug Act required that products containing cocaine be labeled. Coca-Cola quietly removed cocaine from its formula, replacing it with increased caffeine. The name stayed, a fossil of the original recipe. States began passing laws restricting cocaine sales. By 1914, the Harrison Narcotics Act effectively banned non-medical cocaine use nationwide. Doctors could still prescribe it, but under strict regulation. The era of casual, over-the-counter cocaine was over. But the medical need remained. Surgery still required anesthesia, dentistry still required pain control. Doctors had become dependent on cocaine's ability to numb tissue, even as they recognized its lethal flaws. The race was on to find something safer.
Chemists attacked the problem systematically. They needed cocaine's numbing power without its toxicity, its addictiveness, its cardiovascular disasters. They began by studying cocaine's molecular structure. It was complex, multi-ringed, elegant, and dangerous. The same structure that blocked nerve signals also stimulated the heart, constricted blood vessels, and hijacked the brain's reward system. Could they modify the molecule, keep the numbing effect but eliminate the danger? In 1905, a chemist named Alfred Einhorn synthesized a new compound he called procaine, later marketed as Novocaine. It had a similar numbing effect to cocaine, but didn't constrict blood vessels as severely and wasn't addictive. It was safer, though not perfect. It didn't work as well on surface tissues, and some patients were allergic. Other chemists followed. Through the early 20th century, they created a family of local anesthetics, lidocaine in 1943, which became the gold standard. Bupicaine in 1957, longer lasting for surgical procedures. Articaine, mipicaine, ropicaine, each one refined, each one safer. Modern surgery is built on these descendants. When you receive a numbing injection at the dentist, you're receiving lidocaine or one of its cousins, drugs that exist because doctors once used cocaine and watched people die.
The tragedy taught medicine something profound about progress. A miracle cure is not enough. Safety matters. Understanding matters. The enthusiastic adoption of cocaine had been driven by genuine medical need, the desperate desire to eliminate pain, but that need had blinded doctors to danger. The cocaine era established principles that still govern drug development: rigorous testing, careful dosing studies, monitoring for addiction potential, respect for the power of substances that alter the nervous system. Cocaine itself never completely disappeared from medicine. It's still used, rarely, in specific surgical contexts, nasal surgery, for instance, where its blood vessel constricting properties are actually beneficial. But it's controlled, carefully dosed, and used only when alternatives won't work. The recreational disaster continued, of course. Cocaine became a street drug, part of the illegal narcotics trade, a public health crisis that persists today. But that's a different story, driven by different forces. The medical story, the story of how cocaine was embraced, how it failed, and how that failure drove innovation, is about the painful education of a profession.
In 1929, Sigmund Freud was interviewed about his early career. The interviewer asked about his cocaine research. Freud's response was brief, almost dismissive. He said he had moved on to more important work. He didn't mention the patients who had died. He didn't mention Fleischl-Marxau, his friend, destroyed by the drug Freud had given him. He didn't mention the years he had spent praising cocaine as harmless. Perhaps he couldn't. Perhaps the weight of that mistake was too heavy to carry into old age. Carl Koller, the ophthalmologist who had discovered cocaine anesthesia, lived until 1944. He practiced in New York, respected but never quite celebrated, his achievement forever linked to a drug that had caused as much suffering as relief. The doctors who died from accidental cocaine overdoses, the patients who became addicted in hospital beds, the children given cocaine-laced teething powders, they left no monuments. Their suffering is recorded only in medical journals, in cautionary case reports, in the statistics that eventually convinced medicine to change course. But they are the reason surgery is safe today. They are the reason your dentist can numb your mouth without risking your life. They are the reason we have regulations, oversight, clinical trials, all the bureaucratic machinery that seems tedious until you remember what happens without it. The story of cocaine in medicine is not a morality tale about hubris. It's something more complicated. A story about brilliant people making reasonable decisions with incomplete information, about genuine medical need colliding with unforeseen consequences, about a profession learning, slowly and painfully, that good intentions are not enough. Every time a surgeon injects lidocaine, every time a dentist numbs a tooth, every time a patient undergoes surgery without pain, that moment exists because of cocaine, because doctors tried it, because patients suffered, because chemists learned from the disaster and built something better. The miracle was real, the disaster was real, and the legacy is the knowledge we carry forward, that every powerful tool is also a weapon, that every cure carries risk, that medicine advances not through unquestioned triumph, but through the difficult work of learning from our mistakes. Cocaine taught medicine to be humble. That might be its greatest gift.